I'm Charlotte, and this is the diary of my dad, Chris. He was diagnosed with gastric cancer and started this diary to record his journey. I'd like to read you some of the entries from his diary and highlight some key points from his doctor's notes. For the full story, please explore the entire patient journey, including my caregiver insights. To navigate forward, use the arrows at the bottom of the page. You will learn more about Dad on his biography page. These are the moments of truth from Dad's journey, told in 6 chapters, starting when he recognizes symptoms in Chapter 1, delayed diagnosis, to Chapter 2, gastric cancer diagnosis, Chapter 3, primary treatment, through Chapter 4, disease progression, and Chapter 5, post-progression treatment, and ultimately leading up to when his disease took too much out of him in Chapter 6, acceptance. The prioritized moment of truth is here. Simply click the forward arrow to move forward page by page, or you can click on the chapters to go to that section of the diary. You'll see yellow and blue highlights throughout Dad's journal entries. If you click on the yellow, you will see notes from my diary describing the caregiver's insights. To exit my diary, clicking on the X returns to the journal. By clicking on the blue, you will see the doctor's notes. Once again, clicking on the X returns to the journal. You can also navigate using the section headers found at the bottom of the page. Simply click on the section you'd like to read next. Let's start reading some of Dad's journal entries. I'm not feeling 100%. For a few weeks now, I've been having some stomach issues. It feels a bit like heartburn, and I don't have much of an appetite. Maybe it's some indigestion and will disappear on its own, but I'm a little concerned. The over-the-counter meds haven't been able to give me relief from my upset stomach, so I'm going to see my PCP. Why don't I feel better? I've had symptoms for months now. I am growing increasingly unsettled that my doctor cannot figure out what is causing my symptoms. Perhaps it is something serious. Dr. Brandt, primary care physician. Chris's symptoms are beginning to worsen. I am referring Chris to a specialist. Finally, tests might tell me what's wrong. The endoscopy and CT scans make me nervous and are very uncomfortable, but I am optimistic that after seeing a specialist, I can find out what is causing my symptoms. This has to be a mistake. I can't believe what they're telling me. I'm so numb, outraged, and confused all at once. This was not what I had in mind. I didn't even know you could get cancer in your stomach. Here we arrive at the prioritized moment of truth. The diagnosis confirmed. Stomach cancer? I can't believe what I'm hearing. I am not ready to die yet. I shouldn't be in this situation. Why did it take so long to get here? I've been telling my family about my pain for months now. I hope my doctor has a plan ready for me. I'm counting on them. Dr. Lee, oncologist. Diagnostic tests have confirmed that Chris has stage 4 gastric cancer. Surgery is not an option. I need to act quickly. I need to plan out the best treatment approach for Chris. This is the prioritized moment of truth for the oncologist, when the diagnosis is confirmed and the doctor actively begins to plan Chris's treatment strategy. This is another key moment of truth, when the patient begins to accept their reality and look to their doctor for a treatment plan. Tell me what to do. I'm going to be putting myself and my family through a very emotional and stressful experience. It has to be worth it, doesn't it? I need to trust the doctor is doing what's best for me. I want to start treatment immediately so that I feel I'm making a difference. I feel the best first-line treatment option for Chris is a platinum-based chemotherapy and fluorouracil. Chris is in a good mental and physical state and has strong support. He should be able to handle the treatment and continue with some of his responsibilities. I feel like my hands are tied, with limited treatment options at my disposal. I'm relieved to start my treatment. My oncologist has put together a chemotherapy mix that sounds intense, but at least I'll be on treatment. Finally, we are about to do something about it. Chris is clear in what he wants from the treatment, and that assures me that he will find a way to work through this experience. Beyond first-line treatment, there are a few options. This just got real. The first visit to the treatment center was unnerving. I don't want to show any signs of concern that will make my family feel sorry or scared for me. I'm hoping he responds well to the treatment and we can keep him on it for as long as possible. Things are tough. The side effects of the chemo are rough. I don't enjoy eating meals. This is especially hard as our family dinners are how we stay connected. I want to keep a close eye on Chris to ensure I am able to maintain his quality of life. All of this is beginning to get to me. This treatment feels relentless, and the anticipation and anxiety around scans and results has become unbearable. My body is letting me down. Lately, I've been feeling much worse than when I started treatment. I'm not sure what the next steps are going to be. Chris has begun to show signs of clinical progression, and I am anticipating bad news from the next scan. My cancer has progressed. My scan results have come back, and my cancer is growing again. When I started down this road, I promised myself that I'd see it through. Chris dealt with the first line of treatment well. He understands that it was the cancer progression that was causing him more pain, and not the treatment. I can't stop now. I've got to dig deep. I am realistic about expectations, and deep down, I knew it would eventually get worse. I want to have as much time as possible. I'm not ready to give up. I need to be true to myself. It might be time to stop treatment. The side effects of the treatment are becoming increasingly harder to work with, and I am having to manage more pain than before. I am beginning to stumble. I will have to consider what is the right thing for everyone. From here on, I am balancing his symptoms, maintaining his quality of life, and extending survival for as long as possible. On my terms. I've faced my cancer and given my all, but I'm done with treatment. It's time to take control and put my life in order. I want to be my old self and for my family to remember who I really am, not as a cancer patient. I realize I will not live much longer, and I am okay with that. I am proud of my accomplishments and my family. I will find the good in this and celebrate my life. These were some of the experiences that Chris, my dad, went through while dealing with gastric cancer. To understand more about his journey, including insights from me, the caregiver, and more from his doctor's notes, please explore the full patient journey in these pages. We hope this helps you understand the patient and the support roles of the doctor and caregiver through every step of their journey with gastric cancer.